Hello students, our today's lecture is on Treponema pallidum. This is one important pathogen included in this medical microbiology MB 331. In this lecture, we are going to study Treponema pallidum with respect to its classification, morphology, its cultivation, as well as one important clinical infection caused by one species of this Treponema, that is syphilis. Here, we'll see in detail pathogenesis also, where transmission is initial part of it. While studying this Treponema, one should know its classification. So here domain is bacteria, that is prokaryote, phylum Spirochetes, their order is Spirochetes, and family is Spirochetaceae. The important genus included in this family is Treponema. And here the species pallidum that we are going to study in detail. Treponema pallidum is Spirochete bacterium and various subspecies are observed. These subspecies were able to produce various diseases in human being, and these are nothing but a syphilis, Bagel, and yaws. One more disease is there called as a pinta, very rarely observed, but it is produced by the same genus Treponema. This one is basically parasite of human being, that is transmitted only amongst human. It is a helically coiled microorganism. Unlike other bacteria, long, thin helicals or cork screw-like appearance of this organism is observed. Their length is 6 to 15 micrometer long and width is 0.1 to 0.2 micrometer wide. That is, they are very thin. It is very difficult to observe them because of their thickness. Treponema pallidum lacks its metabolic pathways. So tricarboxylic acid cycle, oxidative phosphorylation, they are lacked by this microorganism, and because of which it results in minimal metabolic activities. So here the biochemicals are not important part of the laboratory diagnosis of Treponema. The treponemes have cytoplasmic and an outer membrane, and using light microscopy they are visible only by using dark field illumination techniques. So this microscopic observation play important role while identifying this microorganism present in the clinical specimens. There are total 3 subspecies of a Treponema. One is Treponema pallidum, Treponema pallidum endemicum, and Treponema pallidum pertenue. Each of these subspecies has distinct disease associated with them. And these 3 subspecies causes yaws, Bagel, and syphilis-like disease. These are morphologically and serologically indistinguishable. Therefore, again they create problem in the laboratory diagnosis. In this picture, you can see this cork screw-shaped treponemas. These are helically coiled, and as you know, they are 6 to 15 micrometer long and 0.1 to 0.2 micrometer wide. Here, meaning of this Treponema. Trepo means turning and nema means head. And multiplication of this long thread-like organism occur by binary transverse fission like other prokaryotes. They are motile because of a presence of their long thin screw-like shape as well as a endoflagella. That motility is sluggish in viscous environment. Treponema pallidum is, as you know, helically shaped, and here the outer membrane of which consists of peptidoglycan layer, like gram-negative microorganisms. One inner membrane is present. The inner portion of it is nothing but a protoplasmic cylinder with periplasmic space. So they are often described as a gram-negative. But as you know, that layer, peptidoglycan layer of this organism lacks lipopolysaccharide. We cannot consider it as a true gram-negative microorganism because it is mainly present, lipopolysaccharides, in other gram-negative organisms. That endoflagella of this organism is again unique one. It is also called as a periplasmic flagella. This periplasmic flagella is composed of total 4 polypeptides, as well as there is a core structure and one sheath. These flagella are located within the periplasmic space and so called as a periplasmic flagella, and they wraps around protoplasmic cylinder, because of which that corkscrew-like motility of the organism observed in the viscous environment. They are difficult to culture. Here they require anaerobic media in the laboratory. That media is rich in nutrients, mainly the proteins like albumin, cysteine. These amino acids also present, with sodium bicarbonate and pyruvate. This indicates that these organisms are fastidious in nature. They require many growth factors for their growth. With very difficulty, they grow in the laboratory media. They are microaerophilic, that is, they cannot tolerate high percentage or a dissolved oxygen in their media. Their cultivation can be carried out by using certain conditions in which presence of some tissues of animals can be added. A liquid supplemented with lipids for good growth of this organism. Basically, one strain which is used here is called as a Noguchi's strain of a Treponema pallidum. This is Noguchi's strain, and it is in the absence of a serum. So here composition of this Noguchi's media is nothing but a presence of a casein hydrolysate, yeast extract, dextrose, NaCl, some amino acids like L-cysteine, HCl monohydrate, cholesterol, and one surface reducing agent, that is Tween Bo. So this is all about media which is used for cultivation of these organisms. Now, next and important part while studying Treponema is produced by them. We'll see in detail the disease syphilis by Treponema pallidum species. Syphilis is curable, but it is sexually transmissible infection. And here, syphilis of less than 2 years duration can present with signs and symptoms, which is called as a primary or a secondary syphilis. Or it may be without signs and symptoms. This is called as a early latent syphilis. Syphilis of more than 2 years duration is called as a late latent syphilis, and it is usually asymptomatic. That is, one cannot observe symptoms during this stage, but organisms are present in the body of a patient. That is late or latent syphilis. Now about transmission. These organisms, usually through sexual contact from infected individual or by invading intact mucous membrane or abraded skin, enter in the body. In case of a pregnant woman, where they are not treated or untreated or not treated adequately, chances of syphilis to their offsprings. Here, these organisms can pass placenta during pregnancy and infection occur to the unborn baby. This is nothing but a congenital type of a syphilis. So this is again one important mode of a transmission. I'll repeat. After sexual contact with the infected person, transmission of this Treponema pallidum occur, or secondly, that is from pregnant woman to their fetus via placenta. Potential virulence factors which account for Treponema pallidum's ability to cause disease include several hemolysins. So these are the determinants of a pathogenicity, presence of a hemolysins by the microorganism. Then second one is a membrane protein. This allow permeability of nutrients, but they are inaccessible to the antibody. That is, they can survive for a longer period in the initial stages of an infection. Infection begins when they enter in the body, and after that, they enter into the blood circulation. And it is now disease of a blood vessel and a perivascular areas. Primary lesion is due to inflammation at the site of inoculation where they enter. That is, after portal of entry into the body, they localize at the site where they enter, and one can see primary lesion at the site where they present. Secondary lesion due to inflammation of ectodermal tissues. That is, upon their entry into the blood circulation, they disseminates into the other body parts, and one can see secondary type of a syphilis in the patient. And at the end, there is after latent period, that is hidden period, tertiary lesion due to diffuse chronic inflammation of various organ systems. So this disease in this way divided into stages. First one is the incubating stage, where number of microorganisms increases upon their multiplication by binary fission in the body. After that, formation of initial lesion, primary lesion. So that stage is also called as a primary syphilis. After that, in the further progress of the disease, development of a secondary type of lesions, and it is called as a secondary syphilis. After this microorganism may remain in the latent stage. This is divided into two categories, early latent stage and late latent stage. Here, symptoms are not present. They are not observed, but microorganisms are present in the body. After that, after several years, one can see late or a tertiary syphilis. This one is a life-threatening type of a condition only in untreated cases or having poor immune status. There is an observation of a tertiary syphilis. There is a neurosyphilis, that is involvement of a nervous system, cardiovascular syphilis, involvement of a cardiac system, and gummatous syphilis. One typical symptom which is observed on mucocutaneous junctions of the body, that is gummatous syphilis, is also observed in the tertiary stage of syphilis. Now I'll see in detail about primary syphilis. It is the stage of infection which occurs 3 to 90 days after infection. Here, dose of organism which enter in the primary stage is important. At the same time, immune status of the person. Based on that, you can see the period of incubation. Now, it is most commonly characterized by one single painless ulcer, which is called as a chancre. This is a unique type of a lesion which develop at the site of inoculation, that is where the microorganisms enter in the body. This is mainly the areas like mouth or the genitalia. This chancre is a single lesion. It is non-tender and firm with a clean surface, raised border, and it is reddish in color. This is usually present, as you know, on genitalia, in that cervix, vaginal wall, as well as some times mouth parts also affected. Here, after their entry into that particular area, they invade nearest lymph node, and you can see upon multiplication of it, lymph node become enlarged and non-tender, as well as now draining from these lymph nodes is observed. The chancre, which is a typical symptom of the primary syphilis, has smooth base and it is raised with firm border, but in some person it does not develop at all. That is, this stage, primary stage, may be absent and directly one can see some other symptoms in the patient. So in other persons, it is so small that it may go completely unnoticed. And in others, especially those with HIV infection, multiple ulcers may develop. This is because of a poor immune status of the person. The untreated lesion, that is the chancre or lesions, usually heal spontaneously in 2 to 8 weeks. And now, if there is any progress in primary syphilis, one can see secondary syphilis in the patient. The result of the interaction between large spirochete load and the host immune response is this secondary syphilis. There is a widespread dissemination to various parts of the body, and this is most evident in 6 weeks after exposure to the pathogen. There is now completely febrile illness with fever, sore throat, generalized lymphoadenopathy, headache, rash on palms and soles. The symptom which is developed on the body is called as a condylomata. Like chancre, the symptom in case of a secondary syphilis is this condylomata. There is a involvement of a nervous system which is called as a nephrotic syndrome. Then there is a pain in joints, which is nothing but arthritis, as well as a arthralgia, inflammation of a joints, pain in joints, arthritis and arthralgia. After this, the patient may enter in the third stage of a syphilis. This is called as a latent syphilis. This is the period of a month to years post-infection. The exact reason how that person enter in the latent syphilis is not known. But during this, there is no clinical manifestation. There is no prominent symptom like primary and secondary syphilis. And here, the disease is not observed, but viable microorganisms are present in the body of a patient. So in primary syphilis, chancre; in secondary syphilis, there is a condylomata, while latent syphilis is without showing any such a symptom. In the latent disease, that is in early latent stage, which is first 4 years, no signs and symptoms of active syphilis, but they remain seroactive. That is, antibodies are present against treponema in patient's blood. While in the late latent, that is after 4 years of this infection, in untreated cases, 60% patients continue to be asymptomatic, while 40% progress to the next stage, which is tertiary stage of the disease. In the tertiary stage, there is up to 35% untreated patients. 10 to 25 years after initial infection, they enter in the last stage of the disease. And the symptom which appear on the body of the patient or in the body of the patient mainly mucocutaneous junctions of the body cells. They are affected here. One can see lesion in that part, which is called as a gammas. So in first case, chancre, secondly, condylomata, and third one is gammas. So after 3 to 10 years after secondary syphilis, one can observe these gammas in different body parts. It is non-progressive, localized dermal lesion, that is on skin, one can observe it, as well as on the lips, that is mucocutaneous junctions. It is a benign type of a syphilis, and here there is a pronounced immunologic host reaction. There is a neurosyphilis during this stage, then that is involvement of a nervous system, because of which there is a memory disorder. This is called as a paralytic dementia. Then one very important symptom of the tertiary syphilis is a tabs dorsalis. This tabs dorsalis means nothing but a weakness of muscles as well as abnormal sensations. As nervous system is involved, neurons, peripheral nervous system is mainly affected here. So abnormal sensation is one symptom of a tabs dorsalis. Then there is a meningovascular syphilis, which leads into the seizures. Then there is a optic atrophy, that is visual loss or blindness. Then there is a involvement of a cardiac muscles also, as mucocutaneous junctions present in that area. Chest pain is also common. Then there is a myocardial insufficiency, and at the end, this tertiary syphilis ends into the death. That is, now disease is considered as a fatal disease. So this is all about in case of adults, showing various stages of a syphilis. Now about next category of a syphilis, that is congenital syphilis. So as you know, from mother to fetus, disease may be transmitted. Here transplacental infection in the developing fetus. And initially, if high load of organisms enter via placenta into the uterus, there is always chances of abortions. These are mainly occurs during second trimester of pregnancy. Early symptoms in this case, they are hepatosplenomegaly, jaundice, hemolytic anemia, pneumonia, involvement of a multiple long wounds, as well as a snuffles. So means one can one can check the changes which occur during breathing. There is a noisy type of a breathing. Skin lesions, then there is a formation of a painless lumps on the genital areas, which are called as a testicular masses. So these are mainly observed during the syphilis. So here we can summarize this disease, that syphilis is caused by bacteria Treponema pallidum. This is one spirochete. Early or primary syphilis is mainly responsible for formation of a chancre, which is small painless ulcer present on the genitals, sometimes may present on anus or in rectum portion. It is may present around mouth between 10 to 90 days of their entry into the body. Secondary syphilis is next stage of a syphilis. This stage begins from 6 weeks to 6 months, depending upon immune status of the person, as well as the dose of organism, load of microorganism which enter in the body. So after exposure, up to 6 months, and it may last 1 to 3 months. And here symptom is, that is formation of a condylomata. People with secondary syphilis usually get a rosy copper penny rash on the palms of their hands and soles of their feet. They may also have different rashes on other parts of their body. People may have moist, wart-like lesions in their groin, white patches on the inside of their mouth, swollen lymph nodes, which are lymph glands, that is, draining lymph nodes. There is a high-grade fever, hair loss, as well as a weight loss. When syphilis is in the hidden or a latent stage, then it is called as a latent syphilis, that is without any symptom. The last stage of a syphilis is tertiary syphilis, where there is a blindness, deafness, mental illness, memory loss, destruction of a soft tissues and bone, neurological disorders such as a stroke or meningitis, as well as the involvement of a cardiac system, that is heart disease. Neurosyphilis is the infection of a brain or a spinal cord. And here approximately 15 to 30% of people who don't receive treatment for syphilis will enter in the third stage, tertiary syphilis. And tertiary syphilis can occur years or decades after the initial infection. That is, the period in between secondary syphilis and tertiary syphilis, which is latent syphilis, can be observed in majority of the patients. So this is all about the initial part of the Treponema pallidum, starting from its classification up to entry of microorganism in the body and appearance of a clinical symptoms. In the next lecture, we'll see in detail about immunity, laboratory diagnosis, prevention and treatment to the syphilis. Thank you very much.